Good evening and welcome to Feet Forward, sponsored by the Illinois Podiatric Medical Association. My name is Chris Martin, and tonight's guest is Dr. Debra Young, a podiatrist from the North Side here in Chicago. Welcome.
Thank you.
First-time guest?
Yes, first time on TV.
We've been trying to get you on for months, and you are just slammed there
Yes,
on the North
we're
Side.
quite busy. We're having a lot of foot problems.
Tell me about your
Part.
practice before we get into the nitty-gritty of
I
this,
have a
the
terrific
show.
practice.
Yeah?
I'm on Southport and Diversity, and
Okay.
we have a great variety of patients who, they have foot problems that like to be handled. They want to get well and start running again. A lot of athletes, a lot of sports.
Yeah.
And we have patients with diabetes with foot problems, and they want to learn how to get their foot problems handled and what they can do for themselves. So I have a lot of variety. I have a computerized gait scan that I bought as a toy, but I've learned so much about how people walk. After years and years of watching people walk in my hallway, I have now a computer that can give me more information. So I'm having a ball.
I think I could use that because I think I've been pronating for a long time, and it's at my age it's starting to catch up with me a little bit.
There's
So
confessions there.
yes, it's confidential here though, right? Yeah, you won't tell anyone.
I won't tell anyone.
Just all of our friends out there. So for tonight's episode, we're going to talk about some things that may be a little distasteful for our audience: fungus, athletes' feet, ingrown toenails, and if we have time, we'll dispense a few tips for all you women out there who are scheduling your next pedicure in the next week or
And
so.
men.
And men, excuse me. Sorry. Perhaps you're more in touch with our audience than I am. So tell me about some of the more common sort of causes of toenail fungus. And we'll see if I can scare up a picture here real quick.
And scary is the word.
Yeah, scare up is the... Right, we'll do a sort of a before and after.
Well, fungus infections of toenails seem to be a real topic of conversation, mainly because there's some new treatments lately. Up until now, both podiatrists and patients have just felt like frustration and like, why isn't there like a simple remedy? Why is this such a hard thing? And I know when I was younger, people would say that that's like grandpa toenails.
Right.
They were just associated with old age.
Yeah.
But what really is true is it starts at a young age. And because there hasn't been a really good effective treatment, it just persists over years, so that by the time you're older, the nails have gotten so bad. So they are.
And to a lot of people, it doesn't look that bad, and so it creeps up on you.
And
you let it go.
Yeah. And you think, and actually, once we started really treating it with the newer treatments, the laser and some of the topicals that are more effective, we found out that there's more of a stigma of having fungal toenails. Now, this is something that a lot of different people have. It's not just related to sports, athletic clubs, or pedicure salons. It seems to be related to sometimes your nutrition, your health. And boy, there's a lot of people who just are nice and healthy, and they still have fungus on their toenails. And
So what are some of
varieties.
take us through some of the causes of it?
Some of it's hygiene. If you take a shower every day and you never bother to actually wash your feet or brush your toenails, you'll probably have an accumulation, like a little culture medium. Everyone knows that fungus and mold likes to live on warm, moist places, shower stalls, bathrooms.
Right.
And so if you have warm feet, moist feet from perspiration, sports, and they're in nice dark shoes, great culture medium. So having good foot hygiene, washing your feet, brushing your nails with soap and water. It doesn't even have to be medicinal. It definitely helps. It washes away some of the cells that have the fungal cells on them. And you kind of start fresh. And then what else causes them? Some immune problems where your body can't fight infections, diabetics, HIV, cancer. Some people with those kind of conditions tend to have more of a problem with fungus generally, not just in the toenails.
So when a patient comes to your office and you for this with this complaint, what are some of the things that you tell them? What kind of treatment options do you take them through?
Kind of start with asking them what their lifestyle is like, and actually giving them a little tips on the hygiene and how to cut their nails and how to take care of things themselves. But then also tell them that there's kind of two or three different areas that you could look into as far as treatment, depending on how severe the problem is. And I'd like to also talk about differential diagnosis. Like sometimes a nail will look like it's a fungal infected toenail, and it's not. It's not. It's just so you could spend a lot of time and effort and in good faith try to treat a fungal nail and be real disappointed because it wasn't fungus after all.
How does, as a podiatrist, how do you mentioned differential diagnosis? How do you make the diagnosis?
I take a little snip of that nail and I send it to a pathology lab. It's real simple, just a little clipping. It doesn't hurt at all. Put it in a little plastic bag and send it off to a special pathologist that only does skin and nails. How about that job?
Really?
Pathologist only for skin and nails. And they come back with a very nice report. They actually guide some of the therapy. The biggest thing I've seen is a nail that doesn't have fungus will have something called hyperkeratosis, and it's a thickening of the skin either on the nail or the nail itself. And it's treated completely differently. Primarily it's treated with a keratolytic or a urea cream, and that's not urine, it's urea.
Like gout, for instance. Isn't uric acid builds up?
Yeah. So we write a prescription for a 40% urea compound. And now, just recently, there's a product on that a patient can actually buy online that has this 40% urea.
Is that a prescription? Both of those treatments prescription,
yes.
or
actually, the last one is accessible to the public.
Oh, okay.
So that's nice. And so I tell people how to do it. I dispense in my office, but then also tell them how they can buy it online.
And if those treatments don't work, and how long does a typical patient stay on that regimen?
It takes almost a year.
On that regimen.
It takes that long
before you give up on that.
Yeah.
Really?
Now, there's other treatment. Like some people just don't want to even be bothered.
Yeah. They don't want to wait that long.
They're either too busy, they're traveling, they just don't have the or they've tried all the topicals, all the remedies, and they just can't be bothered. It's just
or it's summer and they're going to be wearing open-toed shoes, and
so I have bought a laser. Now there's a laser treatment that came out a couple of years ago. And some of the podiatrists in Chicago have decided to actually buy one, but there's also a company that will rent them. So podiatrists have really gotten on the bandwagon for treating the nails with a laser. And the importance of that is that there's no side effects. It's not covered by insurance, so it will be expensive and it's out of pocket. But it's perfect for people who either just have tried everything and don't want to be bothered with it, or they want to do it in conjunction with some of the topicals and the brushing and the soaps that are available. The effectiveness rate on that is a lot higher.
For some of the viewers that may not be as clear on what a laser would look like in a podiatrist's office, take us through the sort of the treatment regimen and what they might expect if they need to get or choose to get this procedure.
Sure. The laser is exciting because it's not painful. There's no side effects. And it's very effective. It's up to 88% effectiveness rate. I mean, that's phenomenal. The topicals generally are 15%. The oral Lamisil works very well, has some side effects potentially. You have to take blood tests, and it is only about 50% effective. So
and why do people need blood tests if they're on Lamisil, which is the other?
Yeah, anytime you take a medication, it will sometimes have an effect, and the effect of Lamisil can temporarily elevate your liver enzymes. If someone is young and they're not taking any medications, they're not taxing their liver with a lot of alcohol, Lamisil is very safe. We take a first blood test just to establish what their liver enzymes are, so it's one blood test, and then just watch for any symptoms of having liver toxicity. And then take another blood test, and if you have a problem, you stop taking it, and the liver enzymes will go back down. So it's a pretty safe drug as long as you pick the patient right. If someone is on a lot of cholesterol medicine, they have some health issues, they're probably not going to be the right person to receive a prescription for that. And then the laser, if we decide to do the laser, you don't need any anesthetic. It's not painful. It's actually painless. It looks like a little pointer, like you have for a PowerPoint presentation, a little red pointer. And you just go over it's almost like an imaginary treatment. It's painless, doesn't feel anything, and it kills the fungus on the spot. The clinical studies that the pinpoint laser did with the FDA, they did one treatment in a year, and they got 71.4% effectiveness. But then after the FDA cleared the pinpoint laser, they went back and did a second study where they did 2 treatments in 6 weeks, and they get up to 88% effectiveness. So that's phenomenal.
So I think I've I've seen that procedure done on a couple of patients over the last year or so. Most of the podiatrists I know say that it usually requires 2 or 3 visits.
Yeah. I think most
10 or
people who
15
are
minutes
doing the laser,
per visit.
about that depends on how many nails you're doing. But also it kills the fungus, but it doesn't really change the appearance of the nail right away. So really, it's a little bit disappointing and frustrating that way. There are a couple compounds, especially that urea, that will actually enhance the growth rate. So if you can make your nails grow faster, then you'll see the effect better, faster.
Yeah.
But it's a pretty fast treatment and painless. Everyone's excited about it.
Okay. Before we go into our next topic, we encourage your calls here at 312-738-1060. And if you're in the market for a podiatrist in your area, you can go to the IPMA website. That's ipma.net. Click on the Find a Physician button, punch in your zip code, and you'll get a referral to 3 or 4 IPMA members within blocks of your home, hopefully, at least in Chicago, depending on where you're from. So we also wanted to talk, since we're into nails today,
Yes.
we wanted to talk about ingrown toenails too. And I didn't, I was doing a little research for the show, and I didn't know that heredity, your parents, was sort of a risk factor for
You
ingrown
always blame your
toenails.
mother on something.
Thank goodness. Mom, if you're listening. No.
Well, you inherit the shape of everything. Your nose, your ears, the body shape, the shape of your feet. And so nails are just one other thing. But sometimes the nails will change in shape with trauma, shoes, pressure, certain diseases, I think, if I'm not correct, will change the shape of the nail.
What kind of diseases?
I think it's circulation that will make the nails change the shape and get harder. Or clubbed too. There's some problems with that. But ingrown toenails is what I really wanted to talk about, because most people think of that picture that has the bloody one.
This one.
That one.
Most people think of
ingrown toenails
this.
like
Let's
this.
put this over. Many people think of this.
Yeah, it's
Sorry for
red
the
and
graphic
bleedy
nature of that.
and pus coming out of it.
But you
need an
said
antibiotic.
most of them are like this,
most
right?
people, that's an ingrown toenail.
Now, that doesn't look ingrown to me, but I'm not the podiatrist, of course.
Yeah, those patients, I see many more nails that have no drainage, no
Now,
blood.
Tell me where the ingrown
right
part
there,
is, right here?
Right there, along the sides of the nail.
Okay.
And the reason for that
And here
is
too,
that-
on both sides?
Possibly. If you touch the edge of your nail, it's really sharp.
Uh-huh.
And it's like that for the entire nail plate, so including the sides of the nail. So if you have a nail that just by its nature is a little bit wider, just a millimeter or 2 wider, the edge of that nail is going to press against the skin along the side of the nail and create pain, and even a callus can form under the edge of the nail along the side where it can't be seen.
Okay. Hold
That's
that
what that
thought.
is.
We're going to get our first call of the night for you. Go ahead. You're on Feet Forward. Can we help you?
Yes, I hope so. I have a fungus nail on the great toe. I've had it removed, and when it grew back fungus again. So I'm kind of, what's your feel for moving it? And then you mentioned price, if you had to pay for it yourself. Or can you give us a baseline for what to expect?
Actually, you've brought up a couple of different points. First, you may have had a damaged nail, and every time that nail is removed, the very delicate cells that are at the start of the nail, behind your cuticle, can be damaged, and then they will produce a thicker nail every time the nail grows out. So a lot of nails that are thick and discolored and rough are damaged nails. You may have dropped a book on it, or went dancing, somebody stepped on it years ago, and the nail is actually manufactured as a real thick plate. That is the kind of nail that I would take a specimen of and send it to a pathologist and find out if you actually have fungus that can be treated, or if it's a keratotic nail. In which case, a laser, oral medication, none of that stuff works. You have to have either the urea cream or remove the nail permanently. And that can be done in the office. It's relatively painless. And the way that it works is the nail is removed and a chemical is put at the base of the nail, at the start of the nail, and it sanitizes or sterilizes the root of the nail so it doesn't manufacture nail plate anymore. You wind up with a bald toe, but it's smooth and clear looking, and you'll never have any pain or infection from the pressure of the nail plate. So it depends on what you have. You may have a dystrophic nail.
About the range of price.
Oh, price. It depends on who you're having it done. If it's not covered by insurance, it always is covered by insurance, so But if you're saying you don't have insurance, most podiatrists will have a cash fee. So it depends on which doctor you go to would determine what they would charge.
Kind of work out something, huh?
Yeah. Negotiate the price.
Thank you.
Thank you for your call. We may have another caller. Oh, we'll keep going. Causes of hereditary is not the main cause of.
Sometimes it's trauma.
It is trauma or
Bad luck.
shoes.
Well, I've read articles how they blame shoes, high heel shoes on
The
that.
perception is that shoes are to blame,
But if you think of it, most women have common sense. If you have so much pressure on your toenails that you're causing them to change shape, I would say that most women would take their shoes off, and they would avoid that. But chronic light pressure, I'm not sure if that would really change it, because the nail grows from cells on the base, on the bone. So it actually grows around the bone. So I'm not sure if the shoes would really cause it or not.
Okay. We have another caller. Go ahead. You're on Feet Forward. How can we help you?
Yes, I'm kind of curious. I've always been told since I was a little girl that one side of your body is bigger than the other side. But for some in particular reason, my left foot looks like a pinstone.
Could you turn could you turn your volume down just a little bit, ma'am?
Oh, sure.
Thanks.
It's flat
I'm
and
sorry.
it's wide. And my right foot is a size 8.
One's a size A and one's a size B?
One's a size 10. My left foot is a size 10. My other foot is a size 8.
Oh, okay.
I've always thought it was normal because that's what everybody tells me. But at this stage, I don't think it's normal. I have more issues with my left foot with pain, and my toenails seem to fall off and they grow back weird. Mm-hmm. And just like the other lady, it grows back with the fungus.
Mm-hmm. You may have a congenitally short foot. It's possible. People are born with things that aren't even on both sides. What a podiatrist could do for you, because buying 2 pairs of shoes just to get 1 pair is very expensive and disappointing. You can have an insert made inside of the shoe for the larger one, and maybe put a toe filler to make it so that your shoes aren't coming off on the smaller foot, would fit into a larger shoe, and then have a filler in it. I think that would be a suggestion. You may need to have a little bit more of an arch support on one side if your arches aren't the same height. If you're wearing a smaller shoe on the larger foot, that might be causing some pressure on your toenails. But it would be a good idea to see a podiatrist. We are foot specialists, so we'll take you seriously with all those problems and hopefully come up with a couple solutions for you.
All right. Thanks for your call. And if you need a podiatrist, go to the IPMA website right on the screen there, IPMA.net, and click on Find a Physician and punch in your zip code, and you'll get a few referrals of someone that will help you. Have you ever heard of a case where the difference between sizes is that great?
Short of having a medical problem, probably not. But you can't tell. There's a lot of different kinds of people.
Well, I know it's common for, I think 70% of the population, one leg is a little longer, just a little longer than the other. But 2 sizes, that's rough.
Yeah, that's unfortunate. We're sorry you have that.
Yeah, the bad news is more shoe shopping for her. Oh boy, that's terrible.
Tough break, as long as she has a good paying job.
So let's finish up ingrown toenails here.
Yes.
We were talking about some treatments now.
Yes.
When a patient like the one we showed you, and that person was in pain.
Let's look at the other ones though, because they can be more severe.
This one here?
Yes. So if you look at,
is that
if you
is
look
that the right way?
end on, if you look in the top of the nail, everyone sees a nail that's curved.
Here.
But looking from the end of the toe, it's really curved. And it may
Yeah,
not be
that's right
that
here.
severe, but I've actually seen nails that are so severe that the sides of the nails practically touch.
Ugh.
So it pinches the skin on the nail bed extremely.
Wow.
These nails are very painful.
And how do you treat that?
Well, if they're not as severe, where the nail plate is essentially flat or slightly round on the top, you can simply remove a couple millimeters on the side of the nail and have a nice looking nail and no pain, no pressure on the side.
Is that patient walking without pain, or is that person
Those
in
nails
pain?
can be painful all
That's
the time.
painful, yeah. That looks
Put
painful.
stockings on and
Yeah.
just not having any pressure at all. They just hurt because they're constantly pressed.
I'm in pain just looking at that picture.
Yeah.
That's just, wow.
And if their nails are completely circular like that, it's usually best just to remove the nail. you wouldn't tell somebody to remove a nail if they had normal nails. I mean,
Right.
most people get pretty grossed out about that.
Sure. Yeah.
But if you have to live with a nail that's constantly painful, having a nail removed is a blessing.
So how does the procedure go? Is it in office?
It's in the office.
Local anesthetic?
It's a local anesthetic. It's 2 shots, and everyone hates those shots, but it
Yeah.
only takes about 3 seconds. So.
Sure.
And once you just wait for a few minutes, the toe is completely numb, and you're not aware of anything.
Yeah.
Podiatrists always have. If you've never been to a podiatrist's office, we have special chairs. The working part of the chair is at the feet. So
sure.
we're able to lay you back. Most people have a screen in front of us so you can't see anything.
Right. Yeah.
So it's quite nice. It tips up. It's quite nice. People joke that they'll take it home, take the chair home. But then once the toe is numb, we have special instruments. It's like a toenail cutter, but it's a very fine, straight edge clipper that clips the side of the nail without damaging the skin underneath the nail. So we're simply trimming your nails along the edge all the way back to the cuticle and lifting that piece out, and then making sure that all the cuticle, the matrix, the cells that make the nail are gone. And we take a Q-tip that looks like a toothpick wrapped in cotton, so it's very fine.
Yeah.
Dipping in a little chemical called phenol, which is it's a weak acid, but it's a high concentration. So it's not like hydrochloric acid, but
Sure.
it is the acid. And we dip that in and just put it in the little spot where the cells that make the nail are located. So it's just behind the cuticle. It's almost like a little pocket in there. And we douse that with a little acid and put a little antibiotic ointment on there, and you heal. It's just a matter of putting a little antibiotic ointment and a Band-Aid on it every day. It takes about 3 weeks to heal. So if you don't treat it every day, keep it nice and clean and put the Band-Aid on, it can get inflamed and quite sore. But if you treat it properly, follow the instructions that your doctor gives you, it works out great.
And how active can that patient be after the procedure?
Yeah, if they have a job where, first of all, they can do sports. They can swim, they can take showers and average walking. If they have a job where they have steel-toed shoes or they're on their feet a lot, I would probably recommend it at a time where they're either on vacation or over a holiday, so they have maybe 4 or 5 days where they don't have to wear real constricting shoes. But otherwise, people tolerate it very well.
Are there any new treatments that are available for ingrown toenails?
The reason I wanted to talk about ingrown toenails today and that phenol procedure is because that procedure has been around for about 100 years.
It's not new.
It's an
It's
old
just,
procedure.
It just works.
It's the first thing that podiatry students learn, and so many people don't even know that procedure exists. It's a great procedure, time proven, but it's like our secret hidden procedure. Nobody knows about it. So now everybody in the whole city of Chicago knows about the P&A. Phenol and alcohol are the 2 things that we put on.
Well, that's what happens when you go on feet forward. The word gets out, and then everybody knows.
New
So,
procedure.
that's what we're for. We just have a couple minutes before we wrap up. We talked at the beginning of the show about passing on some tips for men and women getting pedicures. So when you go down a couple of your tried and true tips for people that are getting end of the summer kind of pedicures, we may have another call that we want to get into, but why don't you give us a few tips there?
Yeah, I think the 2 things are make sure the store is clean. Gut feeling when you walk into a place. Most people can appreciate if they have general hygiene standards. The pits don't have dust balls in the corners.
Let's put that on hold now. We just want to get this last caller in. I'm sorry.
Doctors, I want to hear your opinion on this. If something ain't bother you, leave it alone. Now I understand it's a procedure where people can get their toes shortened. I just want to hear your opinion on that.
Unnecessary surgery is probably not a great idea. Toe surgery in particular, you have to be really going to a lot of consideration. There's 3 joints to the toe. There's several tendons, I think there are about 6 tendons, and they're all balanced. And if you start to shave down bones and nip tendons just for a cosmetic effect, and you have a bad result, you'll have buyer's remorse. You'll say, oh my God, my toe never hurt me before, and now I have a poor result. So unless you know the risks going in and the benefits that you're hoping for are balanced and you're realistic, I wouldn't recommend it.
I think I saw a story from the East Coast about that, and I think there was a spokesman from the IPMA pretty much warning consumers not to get into that situation. I think it was done for sort of like uber cosmetic reasons because the person
Yeah.
didn't like the
I've
shape
actually
of her
had
feet.
a couple patients come in over the years where they just want their toes shortened so they can look better in flip-flops and
Yeah.
things. And it's just a mistake. Those questions come out of being naive and not realizing. Actually, bunion surgery is more successful than hammer toe surgery. So now if you're going to go into hammer toe surgery and wind up with crooked or stiff or thick toes.
Don't
what
ruin our next
unfortunate-
shows. Come on, we've got
Yeah.
we've got other shows to fill, but we're out of time right now. Unfortunately, we went over our 25 minutes. So, thank you so much, Dr. Young,
My
for coming.
pleasure. Thank you.
Again, if you are in need of a podiatrist in Chicago, go to the IPMA website. That's IPMA.net. Click on Find a Physician, punch in your zip code, and we'll give you a few referrals. So we'll see you next month. Thanks.